Now we are gathered for a case study discussion of bronchiectasis. So, do you have any idea about what is bronchiectasis?
It is an abnormal irreversible dilation of the alveoli.
Yes, exactly. It is abnormal irreversible damage and dilation of the alveoli. So, do you know the clinical features or the presentation which the patient will be complaining that I'm having this or that? Do you know what it is? Yes, fatigue. Dyspnea. What is dyspnea?
Shortness.
Yes, shortness of breath, that is difficulty in breathing. Yes, perfect. Copious amount of secretions. Purulent amount of secretions will be present by the patient. Any other? In some patients, they will be experiencing chest pain. Any other? So, how would you think you could help such patients? So, what will you do to help such patients to improve their quality of life? Breathing exercise. Any other thing? Chest physio. All combined together, do you know what the name is? Yes, exactly. Pulmonary rehabilitation. So now we are going to share some knowledge about pulmonary rehabilitation. So Jenny is going to explain about pulmonary rehabilitation with a model. So consider her as a patient with bronchiectasis with a copious amount of secretions and clinical features. You have told that breathing difficulty, that is dyspnea, shortness of breath. So Jenny will be explaining further.
Hello all. Moving on to the breathing exercise, ask the patient to sit in a relaxed position. Now, for the first breathing exercise, we will be doing diaphragmatic breathing. Ask the patient to keep their dominant hand over the diaphragm and the other hand over the chest. The dominant hand is placed over the diaphragm for monitoring the movement of diaphragm. Try to breathe in while you bulge out your diaphragm. Breathe in and the diaphragm will be moving out. Now breathe out and the diaphragm will be moving in. This is how we do the diaphragmatic exercise, breathing exercise, and repeat it for 5 times. Breathe in, breathe out, breathe in, breathe out, breathe in, breathe out. Breathe in, breathe out. For the last time, breathe in and breathe out. Okay. Moving on to the next part, segmental breathing. Ask the patient to keep both their hands in the costal area. This is called the costal breathing exercise. Now ask the patient to slowly breathe in and breathe out while monitoring the movement of the diaphragm. Breathe in, breathe out. Breathe in, breathe out, breathe in, breathe out, breathe in, breathe out. For the last time, breathe in, breathe out. Next we will be doing lateral. Keep your hands like hugging yourself. Now monitor the movement of the chest expanding. Breathe in, breathe out, breathe in, breathe out, breathe in, breathe out, breathe in, breathe out. One last time, breathe in and breathe out. Coming to the last segmental breathing, we will be doing for the apical part. Ask the patient to keep their hands over the chest in sideways. We can do it by one, or we can keep both hands on the same time. Now breathe in, breathe out. Breathe in, breathe out, breathe in, breathe out, breathe in, breathe out. Last time, breathe in and breathe out. These are the breathing exercises we will be giving to the patients present with the condition bronchiectasis.
So coming to the next part, so breathing is to improve the dyspnea or the shortness of breath. So what will we be doing for secretions? Bringing out the secretions, what are the techniques you are opting for? Yes, chest physio. What are the techniques in chest physio you will be doing? Shaking and vibration. Okay. Can you please explain, Jenny?
Ask the patient to be in a relaxed position and we will be draining the apical part now. Keep your hands in cup shape and start tapping the
Posterior aspect of your chest. out. And the count should be 100 to 140 repetitions per minute. So the next technique is
Vibration.
yes, vibration. And you have to make sure your elbows are straight while giving the vibration technique. The same as like this, you'll be giving all the beats of your lung. So the next technique is shaking. Yes, shaking. Yes, shaking. Along with this postural vibration technique will also be incorporated along with chest physio in order to remove the secretions even more. So this is all about bronchiectasis and pulmonary rehabilitation that is given to the bronchiectasis patients. Any doubts or questions you can shoot? Yeah. Yeah, chest physio, it depends upon the technique which you are giving. So as I said before, in clapping you will be giving 100 to 140 counts per minute, whereas in breathing exercise you will be giving 5 to 7 according to the capacity of the patient. If the patient is stable